Talk about diabetes in relation to the neuro-ophthalmic system. And the first thing is you should know that diabetes means like honey, and the reason is because your blood and your urine tastes sweet. Diabetes, of course, produces high sugar, and it is that hyperglycemia the high sugar in your blood that leads to glycation of lipids and proteins. And it is that glycation which is an abnormal process in contrast to glycosylation, which is the normal enzymatic way that your body creates glycolipids and glycoproteins. Glycation is an abnormal process that results in the production of advanced glycated end products. These AGEs can bind onto receptors for the advanced glycated end products, and it is these receptors for the AGE that converts age to rage. And it is that rage that produces the signaling mechanisms that result in the problems that we see in diabetes, both through a kill yourself pathway, a suicide pathway called apoptosis, and a homicide pathway where cells are killed or damaged, usually from inflammatory mediators and reactive oxygen intermediates that are free radicals that are destructive. The target, of course, is the perisite. Peri means around, and the cell, the site that it's around, is the endothelial cell. So the perisite is the target of the hyperglycemic induced attack, and it is this poor perisite who suffers the damage. And when that occurs, the endothelial cell in the blood vessel doesn't work properly. That leads to leakage because of breakdown of the blood-retinal barrier, and in the retina, that is what produces the destructive ophthalmoscopic findings of hemorrhage, exudate, and subretinal fluid. That is what we call the non-proliferative form of diabetic retinopathy. However, over time, the progressive damage leads to ischemia, and that ischemia is manifesting as microaneurysms and small vessel disease in the retina. The ischemic retina then produces vascular endothelial growth factor, VEGF, and when that occurs, new vessels form, and that is the form of diabetes that we call the proliferative form of diabetic retinopathy. So really it is hyperglycemia leading to age, and then rage, changes in signaling mechanisms that lead to parasite destruction and loss, followed by breakdown of blood-retinal barrier, leakage, ischemia, production of vascular endothelial growth factor, neovascularization, and proliferative diabetic retinopathy. So for neuro-op, the reason these things are important is when we have the blood vessel supplied to the nerve itself, the vasonervorum, so the vasonervorum, that nerve supply from the blood vessel tends to affect the core of the nerve, as opposed to compressive lesions like masses or aneurysms that press on the nerve from the outside. That can damage the pupil fiber in a third nerve. So in a diabetic third, where we have all of the process that we just described, causing small vessel ischemia at the vasonervorum, that tends to spare the pupil in a third nerve palsy, versus a compressive lesion, which presses on the outside of the nerve, and that tends to involve the pupil. So as a rule of thumb, a diabetic third normally spares the pupil, and a compressive palsy normally causes pupil involvement. So if you understand the basics of this hyperglycemia, you can understand how diabetes causes eye disease.